specialist in Ayurveda, AVM, spine and joint related disorders. So friends, welcome to a live question answer session, live with Dr. Avinash Singh Chauhan. First of all, I want to ask to all the patient. Yesterday I did a live and I give you the gentle reminder to everyone that we are coming on Maharashtra for a 5 days treatment camp. So tell me about that. How many patients are coming and how many patients took appointment? Because a lot of patients are coming to the camp and they are just. That is why, because I am giving a gentle reminder to everyone. So if you have any doubt regarding your camp information, regarding your how to come to my camp area and what should you have to bring in the camp area, so everything I will tell you again, and it is a very polite and gentle reminder to everyone, because a lot of people ask me in the live sessions, yesterday live session, some questions was there, but I didn't take that questions. So the question was, first question was, sir, where it is organizing? So it is in Alandi, Pune. The camp details, it is I'm sharing in the over the WhatsApp, or you can also get in the comment box the details of the camp where we are organizing the, and the name, with the name and the place also. Okay. So prior appointment, we already explained that things, because if you are taking that prior appointment, so the staff at the hospital will give you the priority, and you will definitely you will be the first person, or up to the first 10% which I will see in the camp in the priority basis. Okay. And the second one, the treatment and the slot, the importance of slot which you are taking. So that is very important, because if you are booking your slot, because seats are very limited and the treatment slots are very limited. So if you are taking the slots, so it is very easy and it is very convenience for you, because if you are not taking the appointment, so because lots of patients are coming from not over from Maharashtra and from abroad also. So and from some patient is from nearby states also they are coming. So it is a very it will be a very inconvenience if you are not taking appointments. Third one, that is what should you will come with the cloths, loose cloths, and some bed sheets if you are coming for treatment and if you are booking for the treatment. So these are things. And just last one, if you are coming to our camp area, so before that you need to fill the form, because it is very important. Accordingly we are just booking the appointment and giving the slots. Who is filling the form very clearly, and just with the formalities, if they are filling the form, so the priority basis we are giving the appointments. So let me tell you one thing, because बहुत सारे patient they are just they were worrying about that things. Sir, I am just taking appointment. So I am asking one thing to everyone: how many patients took appointment for Pune camp? Is there any patient? So just you can let me check first. Is there any patient who is coming and they already took the appointment for Pune camp? So I am just checking first. Okay, lots of patients जैसा सूरज यादव they are saying, sir, OPD time क्या रहेगा patient के लिए पुणे में? Okay, so very good. So lot of patients are there. Suraj, firstly I have to check first. Let me check. There is a lot. Suraj is the first one, and one second. दिल्ली से हूँ, आपकी हॉस्पिटल आ रहा हूँ. ओके. So I'm really looking forward to take that, because that is my initiative to make India healthy, and just we are looking forward to make this camp very successful because of you people, because you are coming to this camp, and definitely we try our level best to resolve your problems within a 5 days treatment camp. That's why we are organizing the camp in Pune. A lot of patients are asking about they asked me, sir, what is the line of treatment you will follow in the Pune camp? So I am telling you, the patient who have some doubts, So you can ask me over in the WhatsApp, or I'm telling you very clearly the treatment which I am applying here in my hospital, the same treatment will apply on the Pune camp area. Okay, so that is very easy for you, and because just because of that patient, just because of such patient, they are who's unable to come to my hospital, the facilities and the opportunities I'm giving to such patients, you can attend this camp and you will get that benefited with this camp area. Okay, and I will give you the very satisfactory results in the camp area. So keep sharing this information to everyone who is suffering with this type of disorders, joint disorders, spine disorders, arthritis, and back pain, lower back pain, cervical spondylitis, avascular necrosis, arthritis. So you can share this video, this information to everyone. And one more thing, the best part is their MRI reports. The patient who are coming, I will give you the results on the basis of MRI or X-ray. Okay. So you will feel there is a change, you will feel there is a physiological change in your body, and with the X-ray I will show you the results within a 5 days treatment in over Maharashtra camp. Okay, so if you have any doubts, any questions, you can let me message in my WhatsApp, or you can comment me in the live sessions. Okay, so before going to the questions, I want to ask some more questions to you. How many patients are taking medications regularly? That is very important, because before going to the question, because I think I have to ask some questions to you, because a lot of people are connected with me in live session. So I am asking one question, that is, how many patients are following my live sessions, and how many patients doing exercises regularly in your home, and how many patients following the things as per my instructions. So just tell me, and I want to see your results. I want to see your answers, because every time I am giving you the answer in the live session, that's why I give you some questions, and definitely I will hope so you will give me the answer in the live question answer session. Okay, so has your movements is improved or not, your movements is going good or not, your restricted movement was previously, earlier it was there, but right now it is in good condition or not. So these are some questions. If you are ready, and if you are ready to debate with me, so you can ask me in a live question session. Okay, so so how many patients are getting the results with my treatment? How many patients means, because lots of patients took my treatment, and some patients are going to take my treatment in future. So I want to ask the patient who took my treatment, is there any improvement you are feeling after my treatment or not? Just let me clear very clearly. Is there any improvement? Is there any change in your movement, in your joint area, that earlier it was restricted? Right now it is in good condition. Just tell me first. And before the question I'm just telling, I'm asking to you before going to the comment. Okay, because these are the questions I'm telling to everyone. I'm asking to everyone who took my treatment. So I hope so you will be answering my comment box, and I am watching this thing in the comment section. Okay. So Suraj Jadhav, first comment is Suraj Jadhav, 18 सितंबर को ओपीडी टाइम क्या रहेगा पेशेंट्स के लिए? पुणे कुछ रिलेटिव्स हैं, उनको सैटरडे को छुट्टी नहीं है, तो वो संडे को चेकअप के लिए आना चाहते हैं. No problem, Suraj. If they are coming on 18th of September, so I will be there, and definitely the OPD time it will start from 7:30 to 8:30. In between, we will start the OPD time, and you can send him in between 11:30 or 9:30 or 10:30 in between. So I will consult him very clearly. Suraj Jadhav, so can we get medications and massage oil in Pune camp? Also, definitely you will get all the medications, all the liquids, all the syrups, all the tablets in Pune camp. Ravi Kushwaha, good morning sir. Bottle वाली exercise करने से hip joint में कट की आवाज़ आती है. So no problem Ravi ji, you will continue with the bottle exercises which I already recommended to you. It is very good, and no need to worry about the cut sound, cracking sound which is coming from your hip joint. Okay. Very good morning Avinash Mathur. Very good morning Seema ji. Krishna Thumar, सेकेंड ट्रीटमेंट की दवाई फिनिश हो गई है, सेकेंड मैंने एक्सरे भेज दिया था, आपने कहा था कि दवा चालू रखनी है तो एक्स्ट्रा मेडिसिन लिखी थी वो भी लेनी है सर, और दवा नहीं पीते तो बहुत पेन होता है। कृष्णा जी, यू नीड टू बी कंटिन्यू विद द मेडिकेशंस which earlier I asked one question to everyone, if you are taking medications, are you taking medications regularly or not? So that is that is I think your answer. So if you are not taking medications, so you have to be very clear. If you are not taking if you wanted to see the results, so you have to be follow the medications part and the exercises part, everything you need to be continue. Okay, बुंदेलखंड आर्मी सर साइकिल चला सकते हैं या साइकिल I think you need to avoid, because everybody who's asking me about the cycle and the motorcycle part, so everybody who's suffering, that person who is suffering from avascular necrosis, you all have to avoid these things. Okay. कृष्णा तुम्हारा सर दोनों पैर में पेन है, क्या करूं? कृष्णा, just tell me first what is the location of the pain, where it is, so just accordingly I will tell you what is the location and how you will manage the thing. Firstly, give me the location, what is the exact location of pain. रशीद सर मेडिकेशन ले रहे हैं मगर रिलीफ नहीं मिल रहा है. ओके, नो प्रॉब्लम. रशीद, काइंडली शेयर मी योर रिसेंट कंडीशंस, एक्सरे इफ यू हैव, और what where is the location of the pain. Kindly share me in my WhatsApp, or you can share me the pictures in my WhatsApp. अविनाश माथुर सर, हमारी दोनों विजिट हो चुकी है. यू ऑलरेडी डन योर 2 विजिट्स. ओके, 1 महीने की दवा ख़त्म हो गई है पर दर्द नहीं जा रहा है. Okay, all right. So Avinash Mathur, for these conditions, kindly let me message in my WhatsApp, and after that I will revert you accordingly. Kalpesh Thakur, good morning, Kalpesh. Sir, hi, good morning, sir. Can avian patient can do intercourse with life partner? Definitely you can do, but with some precautions. You can share me in my WhatsApp the questions. You can ask me personally in my Instagram. So that is my Instagram page, that is Dr. Avinash Singh Chauhan, so official, so you can ask me over there. Okay, नेहा भिलिया, गुड मॉर्निंग. अविनाश माथुर सर, मैं कभी कभी बाइक चला सकता हूँ. डेफिनेटली sometimes you can ride bike, but if you have the option, if you have some options with the scooty, so you can replace the bike with the scooties. Okay, so to scooty there is a no risk factors. That's why I'm telling to everyone you can easily ride the scooty. Avian patient also. Avian patient can take mushrooms. Yeah, definitely, no problem, because the mushroom is a good source of protein, good source of vitamins, so you can take. Sailendra, hello Sailendra, good morning. Mohit Lahori, good morning Mohit. Rishikant Dubey, good morning sir. माइग्रेन के लिए ड्रग सजेस्ट करें. Okay, Rishikant Dubey, for migraine, I'm just giving you the one medication name. You can write down here. That is 𝒌𝒊𝒏𝒕𝒎𝒏. That is the name of medications. 𝒌𝒊𝒏𝒕𝒎𝒏. 𝒌𝒊𝒏𝒕𝒎𝒏. That is the name of the medications. Okay, so you will continue 2 times in a day. The first one is you will take with the 20 ml water with 20 ml medications, liquid. So you will take after food, after lunch, and in the night after dinner. Okay, 2 times in a day, and 1 tablet, that is one syrup is, that is 𝒂𝒑𝒑𝒐𝒊𝒏𝒕𝒁. 𝒂𝒑𝒑𝒑𝒐 you will take 20 ml with 20 ml water. Okay. निशु शुक्ला सर, डंडा तो छूट गया है लेकिन गांठी का दर्द नहीं जा रहा है. निशु जी, if you have pain in the knees, so you will continue with the back steps movement for 20 to 30 minutes regularly, morning and evening, 2 times in a day. Okay, you will feel there is a change, and you will feel much better with your knee pain. राहुल वर्मा, गुड मॉर्निंग राहुल जी. सर, मेरे हिप और पेंडली में पेन आ रहा है. और राइट, मोहित लाहौरी, इफ़ यू हैव पेन इन द काफ एरिया और पेंडली में और हिप, if you are feeling pain in the hip and calf area, so you will continue with the massage, the oil which I recommended you at the time of discharge. So you will continue with the oil massages 2 times or 3 times in a day. You will feel there is a reduction in the pain in the calf area muscles or in the hip joint also. अविनाश माथुर सर, रात में दर्द हो जाता है, बढ़ जाता है, झुकने के बाद दर्द ज़्यादा होता है, एक पैर पर शरीर का वजन नहीं रख पाता हूँ. So if you are unable to you Avinash Mathur, because if you are continuing the inversion exercise, the space in between the cartilage and the joint, it will increase. So you will feel the things you are facing right now. You will feel there is a reduction in the problem, and you will feel there is a change. There is a improvement in the conditions. Okay, so you will continue 1 or 2 times in a day. चौकड़ी नहीं लग रही है मोहित लाहौरी. So just give some more time to the conditions, because some patients are getting results. It will take some time, because according to his conditions, because that's all depend on conditions. If everything is going good in the same way, so the result is vary to patient, because the causes and the conditions are very different to each and every patient. Okay. राहुल वर्मा सर, 5 months मेडिकेशन नहीं ली है, फिर भी एक्सरसाइज करता हूँ, फिर भी ठीक हूँ एक्सरसाइज. वेरी गुड राहुल वर्मा, थैंक यू सो मच फॉर शेयरिंग योर फीडबैक और what in the YouTube comments. And definitely, just because of your hard work, just because of your consistency, you are getting the results. And with the diet plan and exercises, you are getting results. So that means you followed very clearly, you followed very strictly the things which I instructed to you at time of discharge. Thank you so much, Rahul Verma. God bless you. Sinchana Reddy, sir, I am on medications. I am getting pain again, sir. Please suggest me solution. Pain will come 2 to 3 days in a week, sir. Okay, Sinchana Reddy, doctor, I think you are Dr. Sinchana. Okay, doctor. So if you are in medications, so you will have to be careful with the instructions. Okay. After the medications, if you are not getting results, or so firstly you need to be very concentrate what you are following right now, because if you are following very clearly the things, that means even I am telling about the instructions, diet plan and the exercises. After that you are getting the pain in the hip joint, so you need to be very concentrate what you are following, and it is not adaptable to your hip joint. So these are the things you have to be very you have to be observed, because it is not easy if the patient are following everything, and if after that they have some pain, so patient have to be observe the things very clearly, because some patients are getting results with the same treatment. If you are not getting the results, so you have to be observe the things what you are doing wrong in your daily routine activities. Okay. GLU, sir, MRI report of knee shows the silver of fluid in the between the fibular insertion of biceps femoris close to tendon footprint, the lateral collateral ligament of knee. What is exactly it is curable? Is it be curable? Glue. Okay, so this case is very different than others. I think the thin silver of fluid in between the fibular insertion of biceps femoris close to tendon. So glue, kindly share me your MRI reports if you have, because the condition is very different, and so firstly we need to be observe the MRI reports. If everything is going different way, so we need to be firstly we need to see the reports, then after that I will revert you accordingly. राहुल कुमार, राहुल वर्मा, सर बस कभी कभी एसी की वजह से पेन होता है, थेरेपी करनी पड़ती है, मेडिसिन चालू कर दूं? Okay, so AC की वजह से, if because earlier I said everyone, just you have, if you are just sleeping in just in below the AC, or you have AC rooms, so for that things you have to be very clear. You have to maintain the temperature of the room in just 24 degrees Celsius. Okay, after that, if you are increasing, if you are decreasing temperature, so your joint will stiff and your joint will stuck. Okay, so for that, for everyone who is using AC during this season, during this atmosphere changes time, so you need to be very careful. You have to be maintain the temperature according to your room. After that, you need to be switch off the AC. Okay, no need to use whole night. Okay, एक्सरसाइज से फर्क पड़ रहा है, दर्द नहीं हुआ है, दर्द का कुछ बता दीजिए. Okay, Avinash Mathur, if you have pain after exercises, so firstly leave a message in my WhatsApp. What is the exact location where you are feeling so much pain? So accordingly I will tell you how you can manage the things. शैलेंद्र चौहान सर, इधर कुछ दिनों से पैर में कमर में दर्द बढ़ गया है. सो नो वरी शैलेंद्र, फॉर दैट यू विल कंटिन्यू विद द ऑयल मसाजेस. एंड फॉर इफ यू हैव पेन इन द बैक, so you will continue with the oil massages and don't sit, don't, you have to be avoid prolonged sitting. If you are doing so, the pain of the back, it will increase. So you have to be very careful for prolonged sitting. If you are doing so, you avoid it from here, from today. सर लेफ्ट पैर में बहुत ही लिंपिंग हो रहा है, क्या करूं? कल्पेश ठाकुर, इफ यू हैव पेन इन द लेफ्ट लेग, so you need to be just you can share me the x-ray first in my WhatsApp. Accordingly I will tell you, or if you have pain, so right now from here you will stop the exercises, all the exercises, just you will skip that exercise part and you will continue with the oil massages and hot fermentation for regular days. Okay, for 2 times or 3 times in a day, you will feel within 2 or 3 days you will much better. You will your pain will reduce, and after that, if the pain is going reduce, you will restart the exercise again. Okay, good morning Sainath, good morning. Medicines खत्म हो गई है कल्पेश. So you can send me your proper address, mobile number and pin code. Accordingly I will send you the medicines according to your conditions. I will send you the medications, and this time medication will totally change. निशु सर, बटरफ्लाई करते हो तो नस में दर्द होने लगता है जब पैर सीधा करते हैं. Okay, so no problem, you will skip the butterfly exercise because if you have pain during this moment only, so skip this moment, rest other you will continue. Nayan brothers, greetings, good mornings, good morning Jafar Pasha, good morning Jafar. अमोल सर, काम की वजह से पुणे कैंप नहीं आ पाता, चिकन ट्रीटमेंट के लिए 27 को उन्नाव आ रहा हूँ, आप हॉस्पिटल में रहोगे? बिल्कुल, आई विल बी अवेलेबल ऑन 27 इन उन्नाव, because if you are unable to, no problem, no worry Amol, so you can join me over in Unnao, Uttar Pradesh, okay, on 27. Nayan brothers, I have stage 2, is it recurable? Definitely Nayan brothers, yeah, a lot of patient I recovered from this disease, from this stage. So just first kindly share me your reports on my WhatsApp. My WhatsApp number is 9424842988. संजीव मिश्रा दिल्ली, आप 12 को हॉस्पिटल में है ना? 12 को आ रहा हूँ, बिल्कुल. यस, आई एम अवेलेबल इन द हॉस्पिटल, यू कैन कम ऑन 12th ऑफ सितंबर. ओके, राजेश वर्मा था, मुझे 5th मंथ की दवाई चालू है और मुझे थाई में और ग्रोइन में पेन रहता है, दवाई कब तक खानी पड़ेगी और पेन कब तक जाएगा? ओके, सो राजेश, यू विल कंटिन्यू द मेडिकेशंस. इफ यू हैव पेन, little bit pain in the groin area, so you will continue with that one step which earlier I recommended in the live session. So you will continue with the single step. I think you remember that step, the pressure which you have to create from the wall with the legs. So that step you will continue for the groin pain. Okay, you will feel there is a change in the within 2 or 3 days. You will feel there is a results within 2 or 3 days in groin pain. सचिन चोलके, गुड मॉर्निंग सचिन सर, मेरे कमर के आगे वाला नस दर्द करता है. ओके, सो फॉर एक्सटर्नल फ्रंट थाई पेन, so you will continue with the massage of 2 times in a day or 3 times in a day, Sachin, for strengthening of your muscles. I think there is a pain, this is a pain of your muscle, not from the joint. So you will continue with the massage, you will feel the pain will automatically subside within 2 or 3 days. Digestion बराबर नहीं हो रहा है. Okay, for proper digestion I suggesting you one or syrup, that is Abyarist. You will take this syrup before bedtime, 20 ml with 20 ml water. शाहिद मुख्तार, डॉक्टर मेरी मेडिसिन का कर दें? बिल्कुल, आई विल, नो प्रॉब्लम शाहिद मुख्तार. फर्स्टली वी नीड टू चेक because the abroad courier services is not available and it is not completely, it is not start. If it is there any chance, so I will give the medications. And one more thing I want to tell you, Shayad, if you have any relatives in India, so I will send the medications to your relative. After that they will send it to your place. प्राची मित्तल, सर मेरे नी में पेन रहता है. Okay Prachi, no problem. For that you will continue with the back steps. And one more thing, the exercises part of knee joint, which is uploaded in my YouTube, so you can check exercises for knee joint pain. So you will continue with the knee joint pain exercises, and you will skip in duration of that exercises you are performing, so you will skip the hip joint exercises. Okay, only with the single exercise, that is knee joint pain. So you will continue with the same for next 3 to 4 days. After that, if you are feeling better with the knee pain, so you will skip knee exercises, you will continue, restart with the hip joint exercises. प्रमोद सर, गुड मॉर्निंग सर, मेरी दूसरी विजिट हो चुकी है. मेरे कूल्हे में रगड़न की आवाज़ आती है, पेन भी बहुत होता है. मेरी 2 महीने की मेडिसिन पूरी तरीके से ख़त्म हो गई, फिनिश हो गई हैं. कृपया मेडिसिन बताइए. ओके, इफ़ यू वांट टू आस्क अबाउट द मेडिकेशंस, so Pramod Kumar ji, kindly share me your recent condition, and accordingly I will send you the medications on your proper address, mobile number and pin code. Okay, just share me the same thing in my WhatsApp. टिकेश्वर, गुड मॉर्निंग सर, मैं लेफ्ट पैर के नस दर्द कम नहीं हो रहा है, क्या करूं? ओके, सो फॉर लेग, if you have pain in the left leg and there is no recovery in the pain, so for that Tikeshwar, you will continue with the medications part only, and you will skip the exercises during the pain area, during duration of pain. After that, if the pain is reduced, then you will restart the exercise again. फूड यूज करना है, जकड़न आ रही है, बट उसके लिए क्या करना चाहिए? कैल्शियम डेली चालू है, अस्थि पोषक सुबह शाम, सुबह एक शाम को एक. ओके, for firstly, the dose of Asti Poshak is not a single tablet. The dose of Asti Poshak is 2 tablets morning and 2 tablets evening. Okay, in a regular days. Or for your stiffness, if your joint is stiffed, so for that you will continue with the all massages. It will give you the results for in stiffness. And if you have pain, if you have any restricted movement, so you will skip that exercises part, okay, for 2 or 3 days. After that you will start again. If the pain and stiffness is going down, you will start the exercise same as earlier you were following. Okay, सर बटरफ्लाई करते हैं तो हड्डियों में से कट की आवाज़ आती है. सर बहुत सर भुजा हुआ चना खा सकते हैं? फॉर इफ़ यू हैव पेन और क्रैकिंग साउंड फ्रॉम योर बोन्स, so you will continue with the Asti Poshak tablet 2 times in a day, 2 tablets morning and 2 tablets evening. For knee pain, you will continue with the back steps and your knee pain exercises. गुड मॉर्निंग सर, मेरी मेडिकेशंस दूसरी विजिट हो गई है. मेरे सेकेंड मंथ की मेडिसिन दवाई अब ख़त्म हो गई है, मुझे अपनी दवाई कंटिन्यू करना. यस योगेश, बिफोर दैट यू नीड टू शेयर विद द एक्सरे, योर रिसेंट एक्सरे. अकॉर्डिंगली आई विल सेंड यू द मेडिकेशंस. Okay, I already shared the link where you can just check and you can take appointment. You can take appointment with this link, and you can fill up the form also through this link. Okay, A to Z lyrics. I am from one second. Okay, A to Z lyrics. I am from Nagpur. I have fungal infection from last 5 years. I take a lot of treatment, but I didn't get any results. Okay, so A to Z lyrics. That is very genuine question you are asking. A lot of patients are asking this question because they are taking a lot of treatment, and even after that they didn't get any results. So that is very obvious. After that, if the patient are coming to me, they're asking, sir, can you give me the results in such conditions? So for that, A to Z relax, kindly share me your proper address, mobile number and pin code with the WhatsApp. Okay, so I will revert you what you are facing. If you have any issues with your hip joint, with your problem, so you can share me that report on my WhatsApp. Accordingly, I will tell you how I can give you the results in this situation. Definitely, because you are suffering from last 5 years for your fungal infection, So just if you have this type of issues, you can share me the pictures also, and don't take any type of steroid for this fungal infection treatment, because after this a lot of patients are coming. They took steroids for fungal infection, and after that they are converting the such patients, they are converting into the avascular necrosis. So for that you need to be very careful. The medications you are using, you have to be very careful. You have to be very careful with the steroids also, because in fungal infection, doctors, all the doctors, they are recommending the steroids for very fast, for fastest recovery, and very in a very mean time, in a very very limited time. So that's why you have to be very careful. जेपी मॉस अभी पाँव फोल्ड करने में दर्द दिक्कत आ रही है. So take some patience. More 1 second, yeah. JP more. So after that you will feel, because some patients have different conditions. So after that, after some time you will get the results in this moment also. Okay, within Khilaria, after this treatment, a lot of people can walk normally and live pain-free life. What is the your observation experience? How long this situation will remain same? That is very good answer. I think one, that is a one question also. It is hiding in the comment, and one answer. So thank you so much, Nitin Khilare ji, for appreciating me and our treatment also. If the patients are getting results, the answer is surely I would like to answer this, and it is a very good question. So the patient, if they are getting results with the treatment, and they are just they are walking like a normal person, the restricted movement is totally clear, so it will remain same. It will be a same in future also, if the patient will follow the same thing as per my instructions. After some time, I am recommending to everyone, just you will go for the MRI to get the exact situation, what it is happening inside the wall, inside the hip joint or inside the ball. So the results is very permanent if you are following very clearly and religiously. You are following all the instructions given by me. So the same thing, if you are suffering also anything, so if you are getting results from this treatment, so definitely if you are following in future the instructions you are following, so your result will permanent, and you will feel there is no problem in future. Touch wood, from this treatment, the patient who just treated by me and they got the MRI results, normal MRI results. After that, after some time or lot of years is happened, they didn't face the avascular necrosis again. So that is the thing I am telling to everyone. If you are following very clearly, so results are very permanent to everyone. Grish, sir, inversion exercise कितने देर करना है? So for inversion exercise, you will continue as per your convenience, because if you are comfortable with 1 minute or 5 minutes, so you will continue with the same. Okay, accordingly, because it depends on bearable conditions. It depends on your tolerance. If you are comfortable with 1 or 2 minutes, if you are comfortable with 30 minutes, so as per your convenience, you will continue with the inversion exercise. So please suggest me the medication for fungal infection and Shirni. Okay, for inversion exercise, for fungal infection, I will send you the medications. Kindly share me the pictures of that fungal infection, whether it is on your body, whole body, or the exact picture. Firstly, I need that pictures. Then I will send you the medications. I can tell you the medicines accordingly. Sir, मैं hospital आ गया हूँ. Okay, Moria, after this live session, I will consult you. 1 second. जेपी वर्मा सर, आप क्या आप हिंदी में नहीं बोल सकते? या श्योर जेपी जी, यू कैन आस्क मी एनी क्वेश्चन, आई विल रिवर्ट यू इन हिंदी ऑल्सो. Bhuvi Ganesh, I am Karthik from Chennai. Now I have stopped all the medication, diet and exercise following nowadays. In the morning I feel better, at night I feel more pain. What will I do? So Karthik, One question I'm asking to you, if you have pain overnight, or with the pain you have any temperature, you have raised in your body temperature, so with this symptom, if you have pain, so just firstly message me in my WhatsApp. Accordingly I will tell you what is the maybe the reason behind this. Okay, if you have night pain, overnight, so that is a very important. We need to be diagnose the things very clearly, whether it is avian or something else you are facing right now. So firstly we need to be observed very clearly. So you will just share me the question I'm asking to you, only with the pain you are suffering with overnight, or with the symptom of any temperature or any other things. So you will share me in my WhatsApp. I will tell you what is the next procedure and what is the next in future you will follow. So good morning, hope you are fine. I'm good. Mohammed Mushir. Sir, is Oxyflex tablet and allopathic or Ayurveda medications, is it a painkiller? No, Mohammed M. Mushir. You can check first in Oxyflex. There is collagen type 2 peptide and Bovacella serrata. That is also a shallaki. You can check with the name of that content. Okay, and rose hip extract, it was there. That is also animal based medications. So it is a totally Ayurveda, it is totally natural. So you can continue with that. And there is no painkiller. Oxyflex is a very genuine pharmaceutical medication. You can search it in Google also. Is there any painkiller in Oxyflex? So you will get your answer without asking me. Ramesh Namde, good morning, sir. When 5 days camp in Hyderabad, so many are waiting. Last time it was just 2 days. Definitely, Ramesh. Surely, in future it will happen. Just stay connected with us. Stay tuned with us in my YouTube. Surely, I will come because I also want to come Hyderabad. It was very good camp earlier. We are organizing 2 days camp. So definitely this time it will be on 5 days camp in Hyderabad. Surely it will in future I will organize definitely. Thank you so much Ramesh ji for calling. Yogesh, good morning. अथर्व सर, हेलो सर, 1 month में मेडिसिन ले रहा हूँ, डाइट भी चल रही है, बट कभी कभी स्टमक पेन हो रहा है, क्या करें? For stomach pain, you will continue with the one medication, that is Amrit Mishran. It is very good medicine for stomach pain during the course of medications if you are taking. So you will continue 2 times in a day, empty stomach, morning and evening also. Good morning, Charan Isparsh, Adarsh ji, God bless you. Shanawaz, good morning. Sachin Cholke, I have completed 2 sessions of treatment and now I have very much relief in pain and movements are a little better than before. Thank you so much, Sachin ji, for sharing your results, for sharing your because I remember your case. You was in last stage of vascular necrosis with total joint effusion and the degeneration and the decay of the ball. It was totally half of the ball it was gone. After that you are getting results, so that is very appreciation, very motivational for everyone who's watching this live session. जगलाल भारती, गुड मॉर्निंग. शाहरुख शेख, गुड मॉर्निंग सर. पेन ज़्यादा बढ़ा हुआ है राइट हिप में. शाहरुख शेख, टेल मी अबाउट द एग्जैक्ट लोकेशन. इज इट द पेन इन द ग्रॉइन एरिया और इन द लैटरल साइड ऑफ द हिप और थाई? गुड मॉर्निंग सर. जो मेडिसिन आपने भेजा उसमें 50% कम हुआ है, लेकिन रात को करवट चेंज करने पर राइट ग्रॉइन में तेज पेन होता है, क्या करना चाहिए ताकि पूरी तरीके से ठीक हो जाए? प्लीज सजेस्ट. So for that, if you have pain in the groin area, so you will continue with the in that single exercise earlier, which I already suggested to everyone, that you will continue with the same live session. You will get that that exercise part, that one single exercise for groin pain. So you will continue with the same Akhilesh Kaushik. You will feel you will feel the improvement within the 2 or 3 days. सर मैं हमारे करवा रहा हूँ, आपको रिपोर्ट सेंड कर रहा हूँ, प्लीज़ रिप्लाई देयर. श्योर शहनवाज, आई विल रिवर्ट यू कैन शेयर मी इन माई व्हाट्सअप. गुड मॉर्निंग सर, आपके हॉस्पिटल में से डिस्चार्ज होने के बाद इंडियन टॉयलेट यूज़ कर सकते हैं? नो नीड टू फॉलो द इंडियन वॉशरूम्स बिकॉज इफ एवियन पेशेंट, स्पाइन पेशेंट, from if you are asking to me, so they all have to avoid the Indian washroom. Even arthritis patient, knee arthritis patient also have to avoid Indian washrooms. विकास शर्मा, झुकने में जॉइंट में पेन होता है, ऐसा लगता है कि कोई नस टच हो रही है अंदर की तरफ. नो प्रॉब्लम. So for that, Vikas Sharma, you will continue with the all massages and with the exercises part. After within a 2 or 3 days, your pain will automatically subside. गुड मॉर्निंग जगलाल भारती सर, नमस्ते. महानारायण तेल, महाविश्वगर्भ तेल, ये दोनों तेल से अप्लाई करना है, मिक्स करके. या यू कैन मिक्स in the same bottle. These two oil you will mix in the same bottle and you will apply on your body. Okay, no need to worry about any side effects. अविनाश माथुर सर, आपसे हाथ जोड़कर विनती है कि आप हिंदी ज़्यादा बोला करिए, हमें इंग्लिश आती नहीं है. लोग जो होंगे इंग्लिश नहीं जानते हो, आपकी बात नहीं समझते होंगे. सो नो प्रॉब्लम अविनाश, यू कैन आस्क मी द. मैं समझ पा रहा हूँ कुछ पेशेंट को हिंदी में प्रॉब्लम या इंग्लिश में प्रॉब्लम है. सम पेशेंट इज बिलोंग्स फ्रॉम आंध्र प्रदेश और सम साउथ एरिया, so they are unable to understand in Hindi also. So that's why I have to I am changing the things because a lot of videos in Hindi, a lot of live sessions it was in Hindi. So that's why I am just giving some live sessions in English for the patient who belongs to south area. So that's why if you have any doubts, Avinash, you can ask me. अगर कोई प्रॉब्लम है आपको तो you can ask me in Hindi also. I will revert you in Hindi for you only. Okay. If anybody, if they have problem to listen or to understand English, you can ask me in Hindi also. आदर्श सेकंड विजिट में मेडिसिन 9 डेज की रह गई है, थर्ड विजिट के लिए आना है बट मुझे पेन नहीं है बिल्कुल भी. आई एम वेरी हैप्पी. वेरी गुड आदर्श, बहुत अच्छा लग रहा है मुझे आपकी बात सुन के, और डेफिनेटली मैं कोशिश करूँगा कि और अच्छा हो जाए पूरी तरीके से. आप बिकॉज मैंने आपका केस देखा है एंड यू सफर्ड अ लॉट फ्रॉम आई थिंक लास्ट मेनी ईयर्स. सो आई होप, आई विश you will feel much better and day by day. गुड मॉर्निंग सर, पुणे कैंप में आने के लिए क्या करना पड़ेगा? फॉर वैभव वेद, फॉर पुणे कैंप यू विल टेक अपॉइंटमेंट एंड वन लिंक इज देयर, यू कैन फिल अप द फॉर्म एंड यू कैन बुक योर स्लॉट फॉर पुणे कैंप. रजत सर, कभी कभी द हैंड के नीचे नी में और शोल्डर में पेन होता है, उसके लिए जो एक्सरसाइज वीडियो बनाए हैं सर, मुझे 3 मंथ कंप्लीट हो गए हैं, मोस्ट ऑफ 90% ठीक हो चुका हूँ. It's unbelievable. Thank you so much Rajat for sharing your experience, for sharing your drastic results over YouTube comments. So thank you so much. It will give you some motivational thoughts to everyone who's suffering from this type of joint disorders from many years. So thank you so much Rajat. God bless you. Anil Bihari, 27 September को कानपुर आ रहा हूँ, डेफिनेटली आई एम अवेलेबल. अनिल बिहारी जी, गॉड ब्लेस यू एंड आई विल, मैं आपसे मिलूँगा 27 तारीख को, आप बिल्कुल आ सकते हैं यहाँ पर. एंड कभी कभी आपको हैंड नी में पेन आ रहा है, शोल्डर में पेन आ रहा है, नो प्रॉब्लम रजत, यू विल कंटिन्यू विद द ऑयल मसाज ऑन दैट पर्टिकुलर प्लेस वेदर यू आर फीलिंग पेन और स्टिफनेस इन द मल्टीपल जॉइंट एरिया. ओके, सो थैंक यू सो मच रजत. गॉड ब्लेस यू. Stay tuned with us, stay connected with us, and God bless you for your speedy recovery. Okay, and wish you a good health and wish you a very very speedy recovery. Sonal Kothari, so left leg में third stage and second कोडी गंभीर सर्जरी की है, half month before can I start exercise? Yeah, sure you can start, but firstly you have to ask your doctor who done your surgery. Okay, because within after 2 months of surgical procedure then I can consult you. Before that you need to be consult with your doctor who done your surgical procedure. Okay, good morning सौरभ. आदर्श का क्या 5 kg बढ़ गया था, वो मैंने लॉस कर लिया है. 4 kg आपने जो बोला था मैंने डाइट कम कर लिया. वेरी गुड आदर्श, गॉड ब्लेस यू. सर एवीएम पेशेंट डिस्चार्ज के बाद इंडियन टॉयलेट, नो 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 नो, यू हैव टू अवॉइड. Sir, where due to a school exam, I have to visit to school to write down exam and results. I have to face pain in hip and knee due to excessive walking in school. Please suggest me Ayurveda painkiller. So, author, there is no painkiller in Ayurveda. So for that, you can share your problem in my WhatsApp accordingly, whether where it is the exact location of pain, so I will revert you accordingly. Okay, no need to worry, no need to take any just take patience. After that, this live session, just leave a message in my WhatsApp, I will revert you. Okay. अमोल सर, थैंक यू सर जी, मुझे कोई दर्द नहीं है अभी तक, कोई ऑयल की ज़रूरत भी नहीं है, पढ़ी जॉब भी ठीक से चल रहा है, अब तो लगता है एवियन नहीं, लगता ही नहीं कि एवियन है। थैंक यू सो मच फॉर शेयरिंग योर एक्सपीरियंस अमोल, गॉड ब्लेस यू। इस आप बहुत अच्छे से फॉलो कर रहे हैं, आप बहुत अच्छा हो रहा है, तो दैट इज़ वेरी मोटिवेशनल टू मी एंड फॉर द पेशेंट्स, फॉर सच पेशेंट्स ऑल्सो। थैंक यू सो मच फॉर शेयरिंग योर एक्सपीरियंस ओवर हियर। थोड़ा सा चलते टाइम पे दोनों पैरों में दर्द होता है, रोशन मंडोरा जी। फॉर दैट यू विल कंटिन्यू विद द ऑयल मसाज एंड यू विल स्किप द एक्सरसाइज पार्ट within 2 or 3 days. You will feel much better with the pain. Karan Ahuja sir, I am coming for the camp on 17th. I am a local guy from Pune. हम क्या हमको भी वही स्टे करना होगा या इवनिंग में घर जा सकते हैं? पुणे 5 दिन आना होगा क्या? ओके, सो वेरी गुड क्वेश्चन. I am clearing the things I am clarifying the things very clearly to everyone. First thing, the patient who belongs to Pune, they will come for treatment half and 45 minutes or 1 hour morning and 1 hour evening. In this way you can manage, or you can take both the sessions in the same time. You will come in the morning and you will stay for 1 or 2 hours. After that I will give you the second treatment. Accordingly we can plan on camp area side. Okay, second thing, you can easily go back to your home. The patient who belongs to Pune, so they will easily go back to his home. No need to worry about the stay facility, because there is no requirement of a stay during the camp duration. Okay, so for the patient who belongs to Pune, so they can easily go back to his home, no problem. No need to stay in for treatment in the camp area. Okay. परक्यूशनिस्ट विकास ऑफिशियल सर, सेकंड मंथ से मैं दवाई स्टार्ट कर दी है बट अभी तक मेरे घुटने में दर्द कम नहीं हुआ है. सो फॉर नी पेन विकास ऑफिशियल, for your knee pain you will continue with the oil massage and back steps. बटरफ्लाई एक्सरसाइज स्टॉप करनी है सौरभ. सेकेंड चेकिंग कंप्लीट कर चुका हूँ रामकृष्ण यादव जी. मेडिसिन कंप्लीट हो गई, मुझे 30% रिलीफ है. थर्ड विजिट की ज़रूरत नहीं है मुझे. फर्स्ट एंड सेकेंड ग्रेड है अगेन. नो नीड टू, देयर इज नो रिक्वायरमेंट ऑफ सेकेंड विजिट, थर्ड विजिट. सो आफ्टर 2 months ऑफ मेडिकेशंस यू विल शेयर मी द रिपोर्ट्स ऑन माई व्हाट्सअप फर्स्ट. सर मेरा वेट 52 kg है आदर्श का, यार इट इज़ वेरी गुड एंड नो नीड टू रिड्यूस मोर देन 52. ओके, बिलो 52. सर उल्टा कितनी बार लटकना है? एज पर योर कन्वीनियंस सर. पर शॉर्ट है, इसके लिए कोई एक्सरसाइज बताइए. सर एक पैर शॉर्ट है, एक पैर शॉर्ट के लिए आप यू कैन कंटिन्यू विद द इन्वर्सन एक्सरसाइज. गुड मॉर्निंग सर, कैन वी वियर शॉक इन नाइट वाइल स्लीपिंग? शॉक्स आई थिंक नो नॉट रिक्वायर्ड. सर व्हाट्सअप नंबर इज़ ओके. सर मसाज ऑयल एक्सरसाइज पहले करनी है, that's all up to you. If you are comfortable with the earlier massage than after that exercises, so that is very good thing. So I shared my report over WhatsApp earlier. Currently facing a second stage. Last month I facing this issue with both legs. Earlier I am corona patient. Doctor told me core decompression not required in GMS school. Just kindly share me your report on my WhatsApp. I think you already shared. If you shared on my WhatsApp, I think I already reverted to you. Accordingly, that revert you can follow. And if you have any questions, so you can ask me again, and you can leave a message in my WhatsApp again. So I will revert you. What is the alternative? And okay, so no problem, Mayank Agarwal ji, you can take medications. Some medications are there, but if you are comfortable with Payasub, so you will continue with the same, because Payasub has some most drastic results. So that's why I am just suggesting to everyone. सर हमें एवियन के लिए के कोई पेशेंट का कंटिन्यू मिल जाए? स्कैनिंग पेशेंट्स 100% हुआ है बिल्कुल. लॉट ऑफ पेशेंट आर देयर. यू कैन सी इन द MRI रिपोर्ट्स इन माय यूट्यूब, सो यू विल गेट दैट थिंग्स इजीली. कविता रायना, गुड मॉर्निंग सर. आजकल मुझे एक्सरसाइज करना में नी और हिप में पेन है. सो नो प्रॉब्लम कविता जी. आई थिंक वी ऑलरेडी कंसल्टेड एंड At that time he was saying, sir, I am coming to hospital for second treatment. So what is your planning? Is there you're coming to our hospital for treatment or not? Sir, uncle reports reveals is hypertension signals in the heel pad. It is a serious condition. So HNKS, kindly share me your report on my WhatsApp. हिमांशी सर, मुझे वापस से स्किन इन्फेक्शन हो रहा है, इचिंग में बिल्कुल आराम नहीं हो रहा है, पैर में बहुत दर्द है. हिमांशी विश्वकर्मा जी, काइंडली कंसल्ट टू योर डॉक्टर, नियर बाय डॉक्टर who has a specialist in skin disorder. If he is a Ayurvedic doctor, so that is very safe for your joint disorders also. And just if you have any problems, so you can ask me in my WhatsApp also. मनीष सर, पूनम मेरी मेडिसिन खत्म हो गई, सेकंड मंथ की एक्सरसाइज निकाल लिया है, मेडिसिन कंटिन्यू रखनी है, 1 ईयर हो गया, मेडिसिन खत्म हो गई. सो नो प्रॉब्लम मनीष. पूनम जी, काइंडली शेयर मी योर रिपोर्ट्स ऑन माय व्हाट्सअप, अकॉर्डिंगली आई विल टेल यू. सर, मेरा नी पेन नहीं जा रहा है. दादा जी, काइंडली शेयर मी योर रिपोर्ट और एग्जैक्टली वेयर द पेन, द लोकेशन ऑफ पेन. गुड मॉर्निंग GM स्कूल. Hip joint AVN second stage, how many days to month or month to move to third stage? Send me what is the treatment, what is treatment, how you treat. Okay, so GM school, kindly share me a report on my WhatsApp, accordingly I will tell you what is the procedure of treatment and how I will treat you according to your conditions. So just leave a message in my WhatsApp. सर, मेरा नाम सोनू है, मेरी 2 महीने की मेडिसिन दवा चालू है, बहुत आराम है, मुझे यकीन है मैं 100% ठीक हो जाऊंगा क्योंकि आप हमारे साथ हैं. थैंक यू सो मच फॉर अप्रिशिएशन. दैट इज़ द वर्ड्स, इट गिव मी द पॉजिटिव एनर्जी. दैट्स व्हाई आई एम जस्ट वर्किंग, and that just because of that words I am able to do the things over 24/7 just because of that motivational words. Thank you so much SK. गीता शर्मा, गुड मॉर्निंग डॉक्टर, मैं आपसे एक दिन पुणे में मिल सकती हूँ, कैसे फॉलो करूँ? डेफिनेटली गीता जी, यू कैन कम टू आवर हॉस्पिटल एंड सॉरी यू कैन कम टू कैंप एरिया एंड यू कैन बुक योर अपॉइंटमेंट ऑल्सो फॉर दैट. अरविंद जैन सर, दवा बंद करने के बाद दर्द वापस शुरू होता है, क्या करें? अरविंद जी, फॉर दैट यू विल कंटिन्यू विद द, यू हैव टू फोकस ऑन योर एक्सरसाइजेज एंड डाइट प्लान पार्ट. ओके, इट इज़ वेरी इंपॉर्टेंट इफ यू आर कंटिन्यूइंग विद दैट थिंग. सो इवन इफ यू आर स्टॉपिंग द मेडिकेशंस, so you will feel much relaxed and much better results with the diet plan and exercises if you are following very clearly. डिवाइन वाइब्स सर, नी के लैटरल लिगामेंट में इंफ्लेमेशन बताई है, चलते टाइम पेन होता है. लैटरल लिगामेंट, डिवाइन वाइब्स, काइंडली शेयर मी रिपोर्ट्स ऑन माय व्हाट्सअप, अकॉर्डिंगली आई विल टेल यू इज देयर एनी द ट्रीटमेंट इज कैन हैपन इन योर कंडीशंस और नॉट. मुझे बहुत दर्द है, एवियन इन राइट लेग थर्ड स्टेज. रंजीत प्रसाद, काइंडली शेयर मी योर रिपोर्ट ऑन माय व्हाट्सअप. 1 सेकेंड. यशी आई थिंक यशी मिश्रा सर, मखाने यू कैन कंटिन्यू, पीनट को रोस्ट करके खा सकते हैं. यस, यू कैन कंटिन्यू. जैन मिया शेख सर, आई एम यूजिंग होम्योपैथिक मेडिकेशंस, कैन आई यूज द आयुर्वेदिक मेडिकेशन फॉर एवियन? डेफिनेटली, बट not with the homeopathic. Okay, the line of treatment of homeopathic is very different than Ayurveda. So there are different ways. Homeopathic is a different ways to the line of action, and Ayurveda is a different line of action. So homeopathic and Ayurveda can't use in the same time. Okay, Jan Mia Sheikh, kindly share me a report on my WhatsApp. First, accordingly I will tell you. Right femoral head पर मैरो एडिमा है. तरुण कुनीश, काइंडली शेयर मी योर रिपोर्ट ऑन माय व्हाट्सअप. इफ यू हैव एनी रिसेंट एक्सरे और MRI, जस्ट शेयर विद मी ऑन माय व्हाट्सअप. सर, मटन अवॉइड करना है, यू हैव टू अवॉइड. थैंक यू शर्मा सर, दवाई ना खाओ तो पेन बढ़ जाता है, मेडिसिन फर्स्ट मंथ मेडिसिन कब तक खानी है? टाइम टेक तो नहीं ले सकता जब जॉब नहीं कर रहा हूँ 1 ईयर से. थैंक यू शर्मा जी, इट विल डिपेंड ऑन पेशेंट कंडीशन. द मेडिकेशंस, द सम मेडिकेशंस आई हैव टू ऐड सम इन सम पेशेंट्स. So that's why the costing of the medications is very different it is very patient to patient and it is very condition to conditions. So that's why if you have any problems, so you can ask me or you can share with me. If you are very religiously, if you are following the diet plan and exercises, you will feel the pain will not come again even if you are stopping the medications. Okay, इंतज़ार रिलीज है. 4 month medications दवाई पूरी हो गई है, 5 months चालू है पर पेन है अभी अभी चलती हूँ, ज़्यादा पेन हो रहा है। रूबी जी, अगर आपको पेन अगर ज़्यादा हो रहा है तो आप एक काम करिए, मेडिसिन को सही से अच्छे से फॉलो करिए, और साथ साथ लटकने वाला मैंने आपको लास्ट टाइम ऑब्जर्व किया था, मैंने बताया था, यू हैव टू बी वेरी केयरफुल विद द इन्वर्जन एक्सरसाइज, यू हैव टू डू, देयर इज़ नो ऑप्शंस, यू विल कंटिन्यू विद द इन्वर्जन एक्सरसाइज। अगर आपको उल्टा लटकने वाला कर रहे हैं तो उससे आपको रिजल्ट ज़्यादा अच्छे मिलेंगे। हिप के सामने और अंदर साइड पेन हो रहा है तो कोई दिक्कत नहीं, आप ऑयल से मसाज करिए। सर एवियन की रिप्लेसमेंट जरूरी है? नो नो नो, देर इज नो रिक्वायरमेंट फॉर रिप्लेसमेंट इन एवास्कुलर नेक्रोसिस और एनी टाइप ऑफ हिप जॉइंट डिसऑर्डर्स। ओके, राघवेंद्र कुलकर्णी, सर डियर सर, avian third stage, can it be cured by only by your medications and exercise as age more than 70 years? Definitely, I already treated in the age of 82 years the patient who was suffering from avascular necrosis. It was in 82 years old woman and 80 years old man. Okay, that is my highest age bracket. So I treated such patients. They are just getting results. They are in good condition. They are doing his own work very clear, very easily, without any support, without any problem. Okay, so definitely I am working, and your patient will get the results with this treatment. So firstly, kindly share me your patient's report on my WhatsApp. Thank you so much, very much, Sarji, for arranging a camp at Pune. Thank you so much. God bless you, Sachin ji, for appreciating. Thank you so much. शाहनवाज सर, मैंने आपको रिपोर्ट्स व्हाट्सएप पे सेंड कर दिया, प्लीज़ रिप्लाई सून। श्योरली शाहनवाज, आई एम रिवर्टिंग यू आफ्टर दिस लाइव सेशन। 26 सितंबर को उन्नाव आ रहा हूँ सर, आप मिल जाएंगे डेफिनेटली। यानवी तनवार, यू कैन इजीली कम टू अवर हॉस्पिटल ऑन 23rd, आई विल बी देयर। सर मेरे को थाई में दर्द है। सूरजजीत, काइंडली शेयर मी योर रिसेंट एक्सरे इफ यू हैव। हिंदुस्तान टेक एम्पायर, पेन कभी बंद हो जाता है क्यों? इफ़ यू आर फॉलोइंग द थिंग्स वेरी क्लियरली, वेरी religiously, so the pain, it will automatically subside, and it will subside the pain, it will continue, it will be permanent if you are following religiously all the things. गेहूं की रोटी खा सकते, 1 सेकेंड, गेहूं की रोटी और वाइट राइस खा सकते हैं? नो, गेहूं की रोटी एंड वाइट राइस यू हैव टू अवॉइड। संजय बारिया, गुड मॉर्निंग सर, बहुत अच्छा हूँ, मुझे मेडिसिन मंगाने का तरीका बताया, मुझे क्या करना आना है? मोहम्मद हबीब, ठीक बता, जस्ट यू कैन लीव अ मैसेज इन माई व्हाट्सअप, आई विल रिवर्ट यू आफ्टर दिस लाइव सेशन। सर मुझे 3rd विजिट के लिए आना है या नहीं? आदर्श जी, इफ़ यू आर इन गुड कंडीशन यू विल कंटिन्यू विद द सेम मेडिकेशन, आई विल सेंड इट टू योर प्लेस। ओके, शुभांगी अतुल सावंत, सर मैंने एक्सरसाइज करूँ या ना करूँ, एकदम नॉर्मल लाइफ, एकदम नॉर्मल फील होता है, जब करूँ तो नी में जॉइंट में दुखता है, ऐसा क्यों होता है? सो शुभांगी जी, काइंडली ऑब्जर्व द थिंग्स, whether it is going good or wrong. Okay, so if it is going wrong way, so you will feel there is a pain in the knee joint, and if you are observing the things, some moments it is hurting you to your knees, so you will skip that moment only. Okay, rest of the things you will continue, and no need to stop the exercise part. That's why you are feeling better. I think you followed all the exercises in earlier days. That's why you are feeling better. सर सेकंड विजिट के लिए आना चाहता हूँ, कब तक आ जाऊँ? हिंदी में बोलते हैं तो हम लोगों को बहुत सपोर्ट मिलता है। सुशील जोशी जी, डेफिनेटली आप एक काम करिए, सो यू कैन कम टू माई हॉस्पिटल ईजिली, और बिफोर कैंप और आफ्टर कैंप। सो आफ्टर कैंप 22 आई विल बी अवेलेबल इन द हॉस्पिटल। अगर आप आना चाहते हैं हमारे यहाँ हॉस्पिटल में तो आप चाहे तो अभी आ सकते हैं, या आप कैंप के बाद भी आ सकते हैं, कोई प्रॉब्लम नहीं है। सर मेरे पेन होने लगता है फिर से, थैंक यू सो मच। याशी सर, पैर में लिम्पिंग ज़्यादा है, क्या करें? यशी तनवार जी, आप कंटिन्यू करेंगे, आप हिप जॉइंट की ऑयल से मसाज करेंगे वहाँ पर जहाँ पे पेन आ रहा है, और आपको एक्सरसाइज स्टॉप करनी है। डीजे मैरी, सर एवियन कितने दिन में 100% क्योर हो सकता है? इट विल डिपेंड ऑन कंडीशंस, एंड काइंडली इफ़ यू आर सफरिंग सो काइंडली शेयर मी रिपोर्ट ऑन माई व्हाट्सअप। सर झाड़ू पोछा लगा सकते हैं? रूबी जी, अवॉइड करना है, बिल्कुल अवॉइड करना है। सर क्या पाया सूप 2 टाइम्स ले सकते हैं? 2 टाइम्स बट 2 डेज से थोड़ा पेन है, कंटिन्यू करिए, कोई दिक्कत नहीं। वसीम कुरैशी, सर इज एनी प्लान फॉर हैदराबाद कैंप? वेंकट रमाना, definitely, because Hyderabad is a very good place. I also want to come over there. So, but is there any plan? So I will definitely come to Hyderabad, and I will organize a camp in for 5 days camp in Hyderabad also. आदित्य घराट सर 1 मंथ हो गए मेडिसिन से लेके, बट अभी भी पेन है, हाथ से उठाना पड़ता है, हाथ से उठाना पड़ता है. ओके, सो नो प्रॉब्लम आदित्य जी, बिकॉज यू आर सफरिंग विद मल्टीपल जॉइंट डिसऑर्डर्स एंड विद एंकलाइजिंग स्पॉन्डिलाइटिस, so that's why it will take some more time. After some days, or is there 1 month, 1 month is completed, so after some time you will come to our hospital for second visit. एक्सरसाइज करनी है, योगा कर सकते हैं, कभी पेन ना बढ़ जाए कि नहीं. योगा करना है, एक्सरसाइज भी करना है अखिलेश. वेट की रोटी अवॉइड करनी सर, लिम्पिंग खत्म नहीं हो रही है, क्या करें इरफान खान जी. फॉर योर लिम्पिंग यू विल कंटिन्यू विद द ऑयल मसाज एंड यू विल फील चेंजेस एंड यू विल फील योर पेन विल ऑटोमेटिकली सबसाइड. मयूर कदम 17 डेज को कितने बजे सुबह पहुंचना है? 7:30 इन द मॉर्निंग आई विल स्टार्ट द ओपीडीज. ओके, so you will reach at 17th morning. Ankylosing spondylitis 𝒂𝒊𝒏𝒕𝒂𝒂 positive can cure or not? Venkatesh, 𝒂𝒊𝒏𝒕𝒂𝒂 we can stop the disease either to cure the permanent and to resolve the ankylosing from the roots. So firstly you need to be very careful, you need to be understand 𝒂𝒊𝒏𝒕𝒂𝒂 is a genetic disorder. We are all the treatment is unable to give the results from a blood test, because if the 𝒂𝒊𝒏𝒕𝒂𝒂 is going positive, so never it will become negative, because it is a genetic or DNA disorders. Okay सर 1 वीक हो गया है, मैं मेडिसिन ले रही हूँ, कभी तो ठीक लगता है, कभी कभी हो जाता है पेन. सो नो प्रॉब्लम, कंटिन्यू विद द सेम मेडिकेशंस एंड चेंजेस समथिंग यू कैन आस्क मी. लिम्पिंग हो तो क्या करें? लिम्पिंग के लिए आप एक काम करिए, ऑयल से मसाज करिए यानी तलवार. ट्वेंटी थर्ड को डिस्चार्ज हुआ था आपके हॉस्पिटल से, अभी तक मेरा पेन नहीं गया और अभी ज़्यादा होने लगता है कि नी पेन करना है, नी पेन. एंड वन मोर थिंग सर, क्या मीठा टोटली अवॉइड करना है? यस, यू हैव टू अवॉइड स्वीट्स एंड ऑल द डेयरी प्रोडक्ट्स ऑल्सो. सर घुटने का पेन है, घुटने का पेन और आत माला हरिकेज काय करो सांगा. ओके, सो आई थिंक इट इज इन मराठी. सो अलका मिसल काइंडली इफ यू हैव मीन्स यू कैन आस्क मी. I think she's asking knee pain, about knee pain. So if you have sorry, काही तुमचा त्रास आहे, घुटण्याचा त्रास आहे तुमच्या, so you can ask me in my WhatsApp. काही त्रास आहे लेकिन मैं क्या, I'm just because I know लेकिन मैं Marathi, lot of patients are coming from Maharashtra, so they already they are just teaching me in Marathi, so how to speak. So काही त्रास आहे तुमच्या, just in this way I think that is the thing I have to ask to patient. अलका मिशेल. शुभांगी सावंत सर, हम 20 को पुणे आ रहे हैं एंड सेकंड मंथ मेडिसिन खत्म हो गया. ओके, नो प्रॉब्लम शुभांगी, वी कैन कम टू कैंप एरिया, नो प्रॉब्लम. कट की आवाज़ के साथ दर्द होता है, क्या करें? सो यू विल कंटिन्यू विद द 𝒔𝒂𝒏𝒕 2 times मॉर्निंग एंड 2 times इवनिंग. सर मैं विनय कुशवाहा, कल मैं आया था आप में आपको दिखाने के लिए, मुझे एवियन है सर, हिप में बहुत पेन हो रहा है. सो नो प्रॉब्लम विनय कुशवाहा जी, यू कैन कम टू माई हॉस्पिटल फॉर ट्रीटमेंट, और यू हैव टू एडमिट फॉर 7 to 8 days ट्रीटमेंट. मानवेंद्र सर, मेरे को लिम्पिंग क्यों हो रहा है, ख़त्म होगा कि नहीं? मानवेंद्र, इट विल डिपेंड ऑन कंडीशंस एंड यू कैन शेयर मी द रिसेंट एक्सरे ऑफ योर्स रिसेंट कंडीशन. ओके सर, कट की आवाज़ की रिवर्ट कर दिया है एंड सर योर मराठी. sorry for that because I am little bit confused. So don't you are clapping in my Marathi language, so I am just trying my level best to improve this language, because when I was in Mumbai for 6 months under training, so at that time the patient who's coming over nearby areas, they don't know English, they don't know Hindi. So even in the Marathi language, I have to converse this to some patients. So that's why something was there, that's like some patient, some female patient was there. So I think in the Marathi, I have to tell, I have to ask the one word, that is mulgi, I think. So I remember that word. It is very, it was very funny. So that's why. So thank you so much, Namrata ji, for appreciating me. विनय कुशवाहा सर, विनय कुशवाहा कल मैं आया था अपनी में आपके. सो नो प्रॉब्लम विनय जी, यू हैव टू एडमिट एंड यू हैव टू टेक treatment for from in my hospital. Okay, so thank you so much, and definitely I will try my level best to improve this language. It is a very good language, and I also want to speak, because lot of patients who from Maharashtra, and they are coming and they are teaching me. I'm not telling they were not teaching me. So they are teaching me, and I also want to learn this language, because it is very very soft and very smooth language. So definitely I will in future, maybe I will be I will some fluency in Marathi language. Thank you so much. And I think all the people from Maharashtra, they will help me to speak. Sir, एक बार मराठी में बोलिए, आप महाराष्ट्र में आने वाले हैं. Okay, 𝒊𝒏𝒕𝒁. Okay, I will try. आमच्या what is this? Okay, so I'm trying �𝒏𝒕𝒁. आम्ही मराठी. अरे यार, it is very difficult. So no problem. Sheikh, some once in a day, one day I will speak in Marathi, if you will help me. Okay, डीजे मेरे साथ क्या मेडिसिन डिलीवर होती है? यस, डेफिनेटली. जस्ट काइंडली शेयर मी रिपोर्ट्स ऑन माय व्हाट्सएप. मानवेंद्र, यस, एक्सरे कराया था, अभी भेजता हूँ. ओके, श्योर मानवेंद्र, यू कैन शेयर मी इन माय व्हाट्सएप. अकॉर्डिंगली आई विल टेल यू. मी पुढचे अत्योधित मराठी महाराष्ट्रायनियर. ओके, ठीक है. मी पुढचे अत्योधित महाराष्ट्र Engineer. Okay. Okay, Sheikh, thank you so much for helping me a lot. Okay, so God bless you, all of you. I think the live is over. Thank you so much. It is very it is very tough language also, I can understand the thing you write down. Namrata, so next time Marathi में live करते. Oh shit, Namrata ji, it is impossible. Firstly, I need to be prepared first for some some words, with the first words for 2 or 3 words. Then after that, live is very difficult to organize in Marathi. Okay, firstly I have to learn lot of things in Marathi. So next time. Okay, so sir, first month medicines complete हो गया है. बैठ के उठने में दिक्कत हो रही है. सो नो प्रॉब्लम. हिंदुस्तान एम्पायर, टेक एम्पायर, सो काइंडली शेयर मी रिपोर्ट ऑन माय व्हाट्सएप. एंड जस्ट इफ यू हैव एनी प्रॉब्लम विद द मोमेंट्स, so you will stop, you will skip the prolonged sitting. Okay, because these are the things if you are doing, so it will create a pressure on the hip joint. So that's why you have to avoid the prolonged sitting. After that, means I'm not telling you for regular days, for 30 minutes if you are sitting. So after 30 minutes you have to stand up and just move. If you can move, or you can walk for 1 or 2 minutes. Then after that you will sit again. So in this way you can manage the things, because you are feeling so much pain during the sitting time. Okay. So thanks for coming in, Masa. Thank you so much. Thank you so much, all of you, for joining this live session. And definitely we will meet soon on 17th of September 2022 at 7:30 to 8:30. मैं कोशिश करूँगा कि आप सब लोगों को अच्छी रिकवरी मिले. And that for that, my team and me, I try our level best to give you the results within 5 days. God bless you, all of you. सब क्वेश्चन आते हैं, कभी बंद हो जाता है, कभी कभी चालू हो जाता है. मैं कभी मिल्क की नहीं, अवॉइड करना है आपको, पूरी तरीके से अवॉइड करना है. ठीक है सर. पेन ज़्यादा हो रहा है, लिंटिंग स्टिफनेस खत्म नहीं हो रही है. शहनवाज, आई थिंक यू ऑलरेडी शेयर मी द हमारे रिपोर्ट्स, सो आई विल रिवर्ट यू अकॉर्डिंगली. थैंक यू सो मच फॉर वेलकमिंग मी इन महाराष्ट्र. गॉड ब्लेस यू ऑल. थैंक यू.